The way you care for chronic disease patients is changing, and are you keeping up as a physician? Hi, my name is Dr. Chuma. I'm a medical doctor and medical informatics specialist and the founder of iScript Care. Are you still relying on office visits to manage patients' chronic conditions? The healthcare landscape is evolving, and remote patient monitoring, popularly known as RPM, is leading the charge. RPM is not just a trend. It's a Medicare-supported program that helps independent physicians track patients remotely, reducing hospital visits and unlocking new revenue streams without adding more to your workload as a physician. That's very important. So, most doctors have heard of RPM, but do you really know how powerful it is? So, what's RPM? RPM is a Medicare-backed program that allows you to track your patient's vital signs remotely. Things like your blood pressure, your blood glucose levels, your oxygen levels, your heart rate is all tracked remotely using different devices. So what happens is patients use FDA-approved devices at home, and the data is sent directly to your practice for monitoring. This means that you can detect early warning signs and intervene before the problem escalates and the patient becomes serious. Medicare is paying doctors to monitor patients remotely. Are you taking advantage? Well, here's a fact that might shock you. 66% of Medicare patients have 2 or more chronic conditions. These account for more than 90% of Medicare's spending. The good news is that Medicare wants you to monitor these patients more closely so that they're reimbursing doctors for RPM services. If you enroll just 100 patients, for example, in RPM, your practice could generate over $120,000 a year, all while improving patients' care. RPM is easier to implement than you think if you have the right system. How do you get started with RPM? So, RPM follows a very simple but a structured process. You have to enroll the eligible patients. So Medicare and private insurance covers for most of the chronic care conditions. Then the next step is that you have to provide them with the RPM devices like your BP machines, your glucometer, your peak flow meter, your pulse ox, all different devices that are connected remotely. So what that means is that the next step is that patient data is automatically transmitted to your practice through a secure system. And your team views the data and looks for any concerning trends. So intervention as needed is then implemented. You adjust the treatments, follow-up that helps prevent hospitalization. So there's no extra burden, no extra paperwork, just smarter patient care. I can tell you this for sure. In a few years, every independent doctor will be using RPM. Will you be ahead of the curve? So, what are the benefits of RPM? RPM is already being widely adopted by a large number of healthcare networks, and it's only a matter of time before it becomes the new standard for patient care. Here is, in my thinking, why independent physicians should act now. Number one, first and foremost, improve patient outcomes. Prevent complications before they happen. You don't want the patient to be ending up in ER. Higher patient satisfaction. Patients feel safer knowing that their vitals are being monitored by the doctor. Increased practice revenue, like I mentioned, you're talking about reimbursements of up to $120 per patient per month. And of course, more efficient workflow. Reduce the unnecessary office visits and prioritize the high-risk patients. So get in now and you'll be ahead of the game. Most doctors avoid RPM because they think it's complicated, but it's not. So how do you start RPM without hassle? Many physicians hesitate to adopt RPM because they think it requires more staff, requires more paperwork, or more tech expertise. Here's the truth. With the right system, you don't have to. We do the heavy lifting for you, so you don't have to do it. At iScript Care, we handle patient enrollment and onboarding, so we identify the eligible patients for you. The next thing we do is that we manage the device and the setup. So there's no need for your staff to train the patient. You actually send that device to the patient address. Then we do the billing and the Medicare compliance for you, so to ensure that you get maximum reimbursement. You then have to just focus on patient care while we handle the rest. It's that simple. So the future of healthcare is here, and you're ready to embrace it? If you're not using RPM, you're leaving money on the table. Remote patient monitoring for me is not just an option. It's a future of chronic care management. It improves the patient outcomes, it increases your revenue, and it literally future-proofs your practice. Yeah? So if you want to join us, I'd ask you to text RPM to our number, which is 833-414-0661, to learn how easy it is to get RPM started in your practice. At iScript Care, we make implementing RPM effortless for independent doctors, so you can provide better care and get paid for it. The opportunity is now. Will you take it?